Welcome to the third episode of Niva Bupa Health Insurance presents Times Network's Living Room Conclave, India Health Mission Season 3, co-presented by Sensodyne. My name is Amita Vadva. Our health mission is a series of episodes that aim to inform, raise awareness of, and educate our national audiences on the essential topics that can save and protect lives through a dialogue between leaders from the public and the private sectors. Of late, there has been an increase in the incidences of chronic diseases, which is a result of sedentary lifestyle that we have been leading. Now, to add to that, high medical inflation and frequency when it comes to the seasonal disease that have been on the rise, like dengue, bird flu, malaria and typhoid, that has now put the entire population at risk. The good news, however, is that India has made rapid progress in the field of medicine and most modern treatments today are available in the country. Indian doctors are acclaimed worldwide and most advanced diagnostic and therapeutic technology is also available here. However, these too come at a higher cost, and in order to afford the cost of treatment in today's times, having a health insurance has become an absolute necessity. Now, while awareness about health insurance benefits have been on the rise, there still exists a lot of misconceptions about the product. Many people still don't have clarity about how a health insurance cover actually works. So in this special episode of India Health Mission, we take an in-depth look as to why making healthcare accessible in India is important, as well as the role of health insurance plays in creating access for the citizens. Now, please allow me to welcome our esteemed panelists joining us here on the broadcast. Ankur Kharbanda, who is the Director and the Chief Distribution Officer at Niva Bupa Health Insurance. Glennis Equera, Health Insurance Expert, Founder Chairman, Glenor Financial Services. Dr. Basant Garg, who is the Additional CEO, NHA. And also we have Shrishti Gosavi, who is the CN Finance Creator, also joining us here on the broadcast. Welcome and thank you very much to all of you for taking your time out today. Dr. Garg, I want to start with you, sir, because the rural communities in India have also been suffering from a significant lack of access to healthcare, sir. The lack of access results in high rates of maternal mortality, infant mortality, malnutrition, as well as low life expectancy and low vaccination rates as well. What are the policies, sir, that have now been put into place to bridge this gap?
Yeah, thank you. Thank you for having me here. Government of India embarked on the Ayushman Bharat program, which is a flagship program. It's an umbrella for 4 huge government schemes targeting each aspect of health for every citizen of India. We started off with the Ayushman Bharat Health and Wellness Center, which was aimed at providing holistic primary health care to the citizens. Already more than 161,000 Ayushman Bharat Health and Wellness Centers are fully operational, offering holistic primary health care, including more than 50 diagnostic tests free of cost to all the citizens. This was started in April 2018. The second big step in the Ayushman Bharat journey came with Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which was launched in September 2018. The scheme provides for secondary and tertiary inpatient treatment for bottom 40% of India's population, that is close to 55 crore people of India. And these people, as you rightly said, they cannot even afford health insurance from their pocket. So Government of India decided that the government will pay the premium. Government will bear all the burden for providing inpatient care to the people. For providing access to digital health records, for improving efficiency in the healthcare system, and for building a digital backbone for health. The Government of India then launched the Ayushman Bharat Digital Mission in September 2021. We have made huge strides under the mission, and we are now delivering a lot of services using the digital way. And finally, addressing the concerns of lack of infrastructure that is required for supporting delivery of health services. The Ayushman Bharat Health Infrastructure Mission, the PM ABHIM, that was launched in October 2021. A huge amount of 64,000 crore was envisaged for strengthening infrastructure in order to provide critical care services to the people.
Right, sir.
So the government has adopted a very holistic approach and it is we are already expanding this.
Right, sir.
The government is supporting it in a big way.
All right, Ankur, bringing the question to you, IRDAI has also announced that it is committed to enable insurance for all by 2047. So what role do you believe that public-private partnerships, as we also call the triple Ps, will also play a role in realizing that goal?
Thank you for having me here. A very important subject which you are saying. IRDA has taken it, and the government of India is saying Amrit Kal by 2047, which says that everybody should be insured for life and health insurance. So if you look at, if I try to decode this, there is around 30% of population who does not have any health insurance. And if you look at the Niti Aayog report, this says this is the missing middle, which is not covered by the government, which is not covered under the group platform, group policies, not covered under the banking scheme, etc., not covered under the retail health insurance. This is the missing middle. And the problem is so acute that 7% of Indian population today goes into poverty because of healthcare issues. Now, I personally feel PPP, public-private partnership, is very important in this area. And there are a lot of things which can be done. IRDA recently initiated a amazing thing, which is unique step by giving one state to each lead insurance. So we are a lead insurance for Meghalaya. Every insurance company is giving one state to add on to the awareness to that place. So PPP can be used to promote telemedicine, because we feel that diagnosis, consultations, etc., can happen on the digital mode, which will make healthcare more affordable and accessible to people. And the last one, most important, is PPP can be used to spread awareness. Joint campaigns can be used to spread awareness about health insurance as well.
Dr. Garg, if I can get your point of view here as well, because even as healthcare delivery systems are concerned, sir, they've moved online to provide contactless care. Digital health technologies have become essential in bridging the gap, sir. How do you believe that Ayushman Bharat digital mission has also facilitated the digital access to healthcare, sir?
Yeah, so the Ayushman Bharat digital mission has just completed 2 years, and it has made a lot of strides in enabling digital transactions. We are keeping the citizen, the patient, at the center of the mission. Without the patient's consent, no health data, no health information is shared. So privacy and security by design is what we are following. We are not bringing any data to any central server, and the data architecture is federated, so we are ensuring all kind of security about the patient data. Also, we have already enabled health information exchange in order to enable patients to send across their medical records, share their medical records with the treating physician. The days when lost records, misplaced records, those days are gone by. Doctors will have more visibility into patient records, and we hope this will lead to better clinical decision making. Our experience, India's experience with UPI and CoWIN has been an eye-opener. People are taking to technology as never before. The way we see people using QR codes, the ease with which citizens are using it, we are now also developing and leveraging similar technology for delivering health services. We have developed the unified health interface for leveraging, for introducing more discoverability of services. So a patient can quickly discover health services, doctors, laboratories, ambulances, blood banks around him. We are developing the health claim exchange for interoperability of health claims, which we feel will reduce the time and the cost for claims processing, bringing in more efficiency in the insurance sector, health insurance sector.
All right, let's go to Glennis now. Glennis, I really want to understand from you exactly. You've also been a veteran when it comes to Indian insurance industry. I want to know and learn from your experience as well, especially when we talk about the insurance landscape, particularly the health insurance landscape. What all has changed?
Thank you very much for having me here. I started my career in 1979. The public sector was the only known sector that handled medical insurance. It was unfortunate that health and human life was given to them because their core was non-life. But very bureaucratic, and everything was physical copies to be submitted, people to be met in person. onboarding was a very cumbersome process, and do not talk about claims. It was so cumbersome because every single claim document had to be submitted physically. People who were in the wealth business took a bad beating because if health didn't get settled, their wealth business also suffered. In the year 2000, of course, the private sector came into play. Things improved a lot, but not to the expected levels. It was in 2010 when the standalone companies came into being. I happened to be one of the first persons to be onboarded into Niva Bupa, the erstwhile Max Bupa. But I'm very, very thankful to the Sahi companies because they did 90% of the work. They onboarded so many agents who did a lot of education to the customers. They did a lot of product selling.
Well, this is something that the next generation Shrishti is looking out for, because you must be dealing with the audiences across various segments through your platform as well. Can you tell us how the needs and the requirements of the millennials and the middle-aged and senior citizens vary as per their stage in life?
So very rightly said by you that the needs and the requirements of all these three stages differ from each other very vividly. So it's based upon three variable factors. It's money, energy, and time. If you see millennials, they lack money, but they have time and energy. If you see middle-aged person has money and has energy, but they lack time because they are juggling with their job and they are juggling with their family. And the senior citizen, they lack energy, but they have time and money. So the health requirements vary based on these factors. Now, if we come to millennials, they are the ones who wants to earn a lot of money. So where they see an insurance policy, they also want certain kind of tax benefits like under Section 80D. They want certain kind of returns from their insurance, which nowadays a lot of insurance companies have started coming up with. They have started coming up with insurance policies that give you guaranteed returns. They've started coming up with policies that are giving them the premiums paid back to them. So these are the kind of policies the millennials are looking at. But when you're coming at a middle-aged person, that person is looking at something more seriously in terms of the health insurance.
Right.
He's looking at a family planning. He's looking to safeguard his family entirely, be it his children, his wife. So he wants to see an insurance policy as it is. But when we are looking at a senior citizen person, he's the person who doesn't want to be a burden on his family when it comes to the illnesses.
All right, so those are very interesting insights that are now coming in. We just have to head into a very short break. Lots more lined up on the other side as well. Keep watching. Welcome back to our show. Niva Bupa Health Insurance presents Times Network's Living Room Conclave India Health Mission Season 3, co-presented by Sensodyne, where today we are discussing the increasing accessibility to healthcare infrastructure. Dr. Garg, another question to you, sir. The government is catering to the masses through the policies and initiatives. One such is the Ayushman Bharat Pradhan Mantri Yojana as well. Can you more elaborate on how Ayushman Bharat Pradhan Mantri Jan Arogya Yojana is supporting India to achieve universal health coverage, sir?
Yes, so one of the biggest problems in health is access to health. Imagine a poor person who cannot even afford food. How he will address his health needs during a health episode? The kind of expenditure that is required for his treatment may push him and his whole family below poverty. To address this problem, the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana was launched in order to support bottom 40% of India's population, that is close to 55 crore people, so that they can walk into any public or private hospital and seek inpatient care for diseases, and then this will prevent them from falling back into poverty. The scheme was started in 2018. It has already seen huge progress. Remember, 2018 it was started in September, and then after about a good 1 year, there was COVID struck, and we lost about 2 years of general treatment which would have been there. But even after this, with the support of all stakeholders, the scheme has now seen more than 5.6 crore treatments, which has been provided to the beneficiaries. The government is, already rolling out new services for better patient experience. More and more hospitals are getting empaneled under the scheme because of timely payments being made to the hospitals. Out of 55 crore individuals, already 25.5 crore people, they have Ayushman cards, which enable them to walk in and demand healthcare services.
All right, bringing it back to you now, Ankur, the two biggest challenges to the sustained availability of equitable healthcare in India are affordability and also accessibility, especially for the other communities as well. What do you believe some of the emerging and innovative ways to drive penetration of health insurances in India?
Yeah, thank you. So there are various ways whereby we can increase awareness and affordability of the accessibility of the product health insurance. One of the big things which can be done is customized product for low income group. Today we have a product, standard product for all across country, but low income group, can we really look at a affordable segment for that product? The second important thing is use of digital assets, because today's millennials use digital assets very efficiently and they're looking forward for it so that they can buy, see their policies, claim all across on the digital asset. The third thing is to increase the affordability of the product is to give them EMIs. Like it can be provided in equal installment, like a 10,000 product. If this can be given in 900 rupees every month, that will be a great thing for people to make health insurance affordable and for all the people. We have tied up with a TPA today who is helping us to give EMIs to our customers. And another thing which we can do is create group of communities whereby we are able to give them, all the members, a low affordable pricing. We have tied up, like we gave to Indian Cancer Society, we gave them a product for all their members of less than 2,000 rupees. And the last thing I would like to add is expand your distribution beyond just the advisors. Look like business correspondents, use post offices, e-commerce platforms as well. I think these are the things which will really help us to increase accessibility and affordability as well.
Absolutely, and that's a brilliant point that you've made there, Ankur, because we also want to talk about in the times that we live in, Shrishti, you can throw more light on that. Many of us do not really want to look foreseeably towards handling medical emergencies, health insurance. That has not been a priority for many of those people in the population when it comes to financial planning in the past. Do you see that changing now, Shrishti?
So to answer to that question, Amita, I would like to throw some statistics to you. So in financial year 2015, there were about 340 million Indians which were having insurance policies in place. 5 years down the line, COVID has hit the country and the number has risen by 43%. And now in 2021 financial year, there were about 515 million people having this insurance policy. So we see a whopping rise of 43%. But at the same time, if you see the overall population of India, it's 150 crore. Out of that, we are talking about 36% of Indians having insurance policies in place. While it's rising, there is still a lot of scope to go and a lot of penetration by the insurance companies that would be required, especially in terms of urban areas.
Absolutely, but still a scope of improvement there. Glenys, what's your take on that? Because given that approximately 50% of the urban population is women, and how important do you believe it is to have women participating in decision-making process when it comes to purchase of health insurance, ma'am?
Yes, I think women play a very, very important role. In my view, I always call the woman the home minister. She actually is responsible for taking care of the children and putting quality food on the table. But I would give her complete total control also on the health front. Today in India, financial aspects is completely the prerogative of the man, still unless she's a working woman. And he's very, very happy to pass on the baton to his wife when it comes to decisions on health insurance. I think the woman is a great influencer in ensuring that every family has a medical insurance, big or small. because end of the day, it's a safety blanket.
Due credit also to the women there, especially when it comes to, raising awareness. And you're also here with us here in the studios. But Ankur, last question. When it really comes to making healthcare accessible, distribution of health insurance products also plays a very big role. Can you highlight more on that? What exactly are the barriers to distribution in health insurance industry?
Three primary concerns today. One is awareness. Awareness is still very low for health insurance. Second is trust. My sense is people still do not trust all the health insurance companies saying that they will be paying their claims or not. The third is affordability. And at Niva Bupa, we are doing a lot of things to ensure that these three things are taken care of. Let me put it one by one. First is we are adding a lot of advisors. We today have 150,000 advisors. One of the big focus area is, can we add women and the senior citizens also into that? Well, how it helps is women and senior citizens are more trusted by the society, and this helps to take care of the trust issue. Second thing what we are doing is we have a lot of bank ties. We have 20 bank ties today where they have 40,000 branches, which means that if we are available at all those 40,000 branches, and which means that accessibility of health insurance is provided over there. The third thing which we are doing is we are setting up branches all across. Today we are present in more than 180 cities. We have 200 plus branches. So these are all the things which are helping us to take care of these three issues which we spoke about.
Right. Thank you very much, Ankur, for that update. So as we talk about, even as those times that have been changing and ensuring a safe future should be the mindset for anyone who wishes to be prepared for medical emergencies. Thanking our guests also joining us here on the panel. Thank you very much for watching.